Steve Carell had a bad day.
Yes, a bad day getting his hip replaced.
Yeah, a lot of people have sent this video to us about Steve Carell recounting the day of when he had his hip replaced. Mr. Carell, Steve, if we may, on behalf of orthopedic surgeons across the globe, we apologize that this was such a negative experience for you.
But we're going to break down his video where he talked about it on a talk show recently and
try and explain some of the things. Now, it often takes a comedian to highlight flaws or cracks in society. You know what I mean? And that's one of the great things that happens with comedy. Is you learn some stuff. You know, I like to dabble in a little bit of comedy.
Yeah. Wait, so you're a surgeon that dabbles in a bit of comedy?
Well, that's better than a comedian that dabbles in surgery.
Fair enough.
Right?
Fair enough.
However, this comedic little vignette of Steve Carell's hip replacement really highlights a few issues of orthopedic surgery and hip replacement that we wanted to talk about.
Right.
So if you want to go through it with us, stick around.
Okay, here we go.
So,
I read, and I hope this isn't too personal, that you had a hip replaced.
I did. That was a bad day.
That must be a pretty bad day.
okay, that was a bad day. We apologize.
We don't want to hear that.
We're sorry it was a bad day for you. I mean, it's not a fun day, or it could be a fun day, but it's not a fun day, but it's a good day because you're getting rid of your hip pain.
Your whole
finally.
life is going to change.
All
yes.
right, let's carry on.
Yeah, that was almost exactly a year ago. I had a hip replacement, a full hip replacement, and I held off as long as I could until the doctor said, hold off until you start to limp and then have a hip replacement. So I went in, my wife brought me in.
Hold off as long as you can. And that's common practice. That's what we do as well. We tell people to wait as long as you can. Why do you wait as long as you can?
For me, I tell people because then your relative improvement is going to be so much greater.
Okay, because you're in more pain. I tell people because hip replacements don't last forever.
Yep.
So you want to be as old as you can be so that hopefully the hip replacement outlasts you eventually.
I also tell people because there are risks. So you want to know that if, heaven forbid, you do get one of the very uncommon complications, you want to know that you had no other choices.
Right. Okay, let's carry on.
And then Yolanda shaved my pubic hair, I'll just say it. And, which I didn't know. I didn't know Yolanda was going to be doing that. And she just decided,
Okay.
So, got the pubic hair shaved.
Yep.
So what does that tell you about the approach? What approach do you think he had?
The anterior approach.
Yeah, probably had an anterior approach to the hip.
Yep.
And we shave the skin before we make an incision to minimize the chance of infection.
Right.
Years ago, we used to ask people to shave at home, but then there was a study that showed that actually the bacteria count on the skin went up if you shaved the night before. So we shave in the OR or outside the OR, the area where we're going to make an incision. It doesn't matter what the approach is, wherever you're going to make an incision, we like to shave the hair off. Okay?
Right, but I think this highlights the lack of communication or miscommunication is a big part of all of surgery and most of life. I'd say most disappointments and things like that are often related to miscommunication.
Yeah, so there's two things at play here. There's one, communication between the doctor and the patient.
Yep.
That is one of the biggest sources of dissatisfaction with patient experiences. And two, the fact that patients forget 60 to 80% of everything the doctors tell them.
That's right.
Which is why we made this channel in the first place.
Yes.
Mr. Carell, Steve, if we may, Talking with Docs has a lot of this information for you to watch these before your surgery. I'm just saying, I'm not saying it, I'm just saying. Just saying, might have helped a little bit.
Send your friends.
So we're not saying you forgot everything the doctor told you.
But you can imagine that if you were told this beforehand, you'd be less surprised, it'd be less traumatic, and you'd be better off.
So again, we apologize for your bad day. So we're at the point, Mr. Carell, Steve, if we may, you're in the OR or outside the OR and you've just had the skin prepped by shaving.
Yep.
Let's carry.
And like the baboon, no one tells me anything. So the pubic hair is shaved, and then the doctor came in and said, so let's talk about your hip. What do you want it made out of? And I thought, this has been months leading up to this. And I'm about 20 minutes from having this permanent piece of body installed. And well, you could go, it's like I'm picking out a car.
Yeah.
You could go with the titanium, or you could go, now, I'd recommend the ceramic because it's very, very durable. You might be able, it might last forever. However, it might squeak. That's the one, the one down.
All right, what's the deal with the different materials?
Right, so in joint replacement surgery, there are a lot of different kinds of materials that we use to balance the risk of wear the risk of prolonged damage and function.
And fracture.
Yes,
Some
fracture.
materials are more brittle than others. So,
Right.
and we have a video that talks about different materials that hip replacements can be made of. So typically the stem is made of some kind of metal, usually a titanium stem, and it's either cemented in or bone grows into it.
Yeah.
Then the bearing surface, which is the ball and the socket, that's where you've got some choice.
Right.
The ball is usually a cobalt chrome
Yep.
sort of metal, very well polished, or a ceramic ball.
Right.
Okay, ceramic wears less. And is actually more polished and smoother than the cobalt chrome.
Yep.
And then that goes into the socket, which is going to be either made of high density polyethylene or ceramic as well.
Or even metal.
Or metal.
Yeah.
Metal on metal hips have fallen out of favor, but they do still happen.
They're still doing
So there are different materials. Now, is it up to the patient to choose the material? What's the right answer? Should a patient be choosing it? Should the surgeon be choosing it?
So I think depending on a bunch of things. For me, if they have to pay for it, I think the patient, like if you're in a setting where the patient's paying for it, I think that might be something that comes into it. But I think the surgeon should be making recommendations, and then the patient ultimately can make that decision with the surgeon.
Fair enough. Personally, the way my practice goes is everybody gets a metal on polyethylene.
Yes.
Because the reasons are, one, that's tried, tested, and true.
Yep.
The polyethylene is so good now that the wear rate is so small. In fact, I've never seen one of the hips I put in 20 years wear out.
I know.
They break, people get infected, and have to have revisions for other reasons, but I haven't seen wear.
Yeah.
So I don't appreciate the benefits of a ceramic hip.
Right.
Because there are risks with ceramic.
Yes.
And ceramic is brittle. It doesn't resist fracture as well, so it could break. And the squeak. They talked about the squeak.
The squeak for sure is more common in a ceramic hip. And the other one is the cost in a socialized benefits.
Yeah, it's a little bit more expensive.
Yep.
But the squeak happens when you have a ceramic ball on a ceramic socket. Some of them do squeak.
And this is audible to other people potentially.
Yes, and often now what's very common practice is to use a ceramic ball and a polyethylene liner.
Right, gets rid of the squeak.
Will not squeak. Okay, so let's carry on.
Or it might squeak. That's the one downside. Like, okay, do you want it to last, but do I want the squeaky hip? So I went with the ceramic squeak hip. Yeah. And I said, give me the squeaky one. So they doped me up, and the guy doing the anesthesia said, now, do you want to see any of the operating room? Do you have any awareness from here on out? And I said, not at all. I want to be asleep for the next several weeks. Yeah. I don't want to have any recollection of this. So he gave me my medication, but it.
Okay, so what's the deal with the anesthetic?
Right, so
awareness?
likely he had a spinal anesthetic and then some sedation. So the spinal anesthetic often is done in another room called a block room before the operation begins. And then as you transition from the block room to the operating room itself, you can be given medication to make you sedated. There's also medication to make you not remember. Yeah. And there is some dealer's choice there for, depending on the safety by the anesthetist and your desire to be aware, they can make you more sedated, but not necessarily require something else to help you breathe.
And we've talked about this in a video before, our spinal anesthetic video. Yep. If you go watch that, we do ask the anesthetist. Some patients want to be not aware, and they're worried if they get a spinal anesthetic, they're going to be aware of everything, but they can give you other medications that make you sleepy. So amnesia, analgesia, those are two of the hallmarks of anesthesia. They forget what's going on, not be aware of what's going on, and not experience any pain.
Right.
So that is an option. It sounds like the amnesia part didn't quite kick in yet.
Right.
Okay, let's see where it goes from there.
But it didn't quite kick in as quickly as it should have. They rolled me into the operating room, and it looked like a torture chamber. It was. There was a bed. There was the operating table. Looked like a spit, a rotisserie that you would roast a chicken on. And what they do is they put you on this, they strap you down, and they turn you around so they can get better access
in wherever they need to go.
Wherever, to chop out the hip. And
that's probably the HANA table, which is used for the anterior approaches.
Yep.
We'll show an image of a HANA table.
Sure.
And that's commonly used with an anterior approach.
Because it allows the surgeon to manipulate your legs. It allows the surgeon to manipulate your legs into a specific position to provide access to your hip. And the trouble here is that he asked to be heavily sedated and wasn't. And that's something that could have been assessed kind of by the team before they brought him in. They could have waited a minute or two just to ensure that he was more sedated.
Again, apologies, Steve Carell, Mr. Carell, Steve, if we may.
And I saw axe saws and the last image that I had in my head was a woman putting on a helmet.
Axe, saws. Okay, what are some of the equipment you're going to see on the table?
So there's definitely no axe.
There's no axe.
There's no axe, but definitely there is a saw. There are drills and something called reamers. There are hammers for sure, and then the implants themselves.
And these instruments are used to prepare your pelvis and your femur to receive the implant. So reamers, brooches, and then the mallet or the hammer is used to implant the components as well.
And I'm not even kidding. It was a helmet with a huge, like a visor and a light. And I just saw these eyes, and then I went out in abject terror.
Oh no.
And then I had my
But it was...
Okay, so what's that helmet?
So in surgery, there are helmets that allow you to have a shield to completely cover your face to protect you from the splash of blood or you coughing on the wound, and they allow it to ventilate, but it looks like you're going to space.
Yeah, they're called hoods. They are used in some ORs. They've been around for many years. I'm not sure if the evidence supports their use for minimizing infection or not.
Agreed.
As far as I know, they don't usually.
Probably protects you more than anything.
But they are an option. I don't use them in the OR.
I don't
We
either.
used to use them here before, but I don't think anyone around here is using them anymore. But these are hoods. That's what Steve Carell saw, but it does look intimidating.
Yes.
And then, going to sleep in terror.
Yes.
We apologize.
It's not ideal.
No, you want this to be a relaxing as possible experience. And not a bad day.
No.
So again, we apologize for your experience, but thank you for sharing that in such a comedic way and highlighting some places where we can improve medicine and orthopedics and hip replacement in specific.
There you go. Now you know all about what's going to happen as you go from the block room to the operating room. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. And thank you very much, Mr. Carell, Steve, if we may, for letting us share your experience with everybody.
See you next time.